Hi, today I'm going to talk about the clinicians, how they work in the system and how they process data and how they generally operate the system from the call center point of view. So I've logged into the system as a nurse and I have access to my patient group. In this case, I am a nurse in the patient group for heart failure, which is called CHF, Department B. From the administrating point of view, you can see there is a ton of patient groups in here, which all of these can coexist in the same time in the system. But as a nurse in the heart failure patient group, I would normally only have access to my own patients and can only see the ones in my little patient groups. As you can see on the screen, a limited number of patients from the entire system. But there can be a multiple set of patient groups that are in parallel being monitored by parallel teams. And since I'm a nurse with specialty in heart failure, I have my patients, and the other ones with diabetes or COPD or pregnancies or midwives, they have their patients in their patient groups and operate with them and fix those patients and receive their data. And today I have on my list, I have Lisa. And before I look at the data that has been submitted from Lisa from home, I will have a look at what she's actually, what kind of patient she is. So I go into my basic data and look at the trending curves for Lisa and see how she's progressing. And she has a number of issues here. She's been monitored for a lot of things, as you can see. What's interesting about these graphs is that there are red lines describing the red level threshold and yellow lines describing the yellow level threshold. So for something like a pulse, there will be a threshold above and below, with the two yellow lines close to each other and two red lines close to each other. So what we want to see is if data is between the yellow lines, they are green, which is okay. If they're outside of the yellow lines, they are non-compliant and therefore something we need to address. So knowing the basic data from the patient is also important. Thresholds that has been applied to each patient are listed in the basic data. So when the data is enrolled into a patient group like heart failure, they automatically inherit all the thresholds in that particular patient group, which means if you are entered into several patient groups, you will inherit those thresholds automatically. And in this case, Lisa is a comorbidity patient. She is heart failure patient. She's also pregnant, which is fortunately not a chronic disease. So as you can see here on the threshold, she has some different thresholds, some different monitor parameters. And she's watched on a number of issues like blood sugar and pain scale, peak flow, saturation, temperature, weight. It doesn't necessarily make sense, but example here is that thresholds can be both absolute, which is important if you cross a given blood pressure, but it can also be relative. In the case of heart failure, a relative threshold means that if the weight increases, I can set it up to flag an alert when the weight increases, no matter what it goes from and what it goes to, which means that even a minute increase of the weight, which is extremely important with heart failure patients, can be tracked and alerted brought to attention for the nurses in the call center. So this is the threshold we're working with, and we saw the trending analysis already. So now that we know the patient and know which thresholds we have and what to do, we can go back to the patient and see how they are doing and process the data that's been received. In this case, we have the data here, and we can immediately go in and decide what kind of intervention we want to do. And in this case, we're going to say that we made a call to the patient to check up, because a warning level alert doesn't necessarily mean that we have to be submitted to the hospital. So we have made a checkup call, and then we save this and acknowledge the patient. So now Lisa is immediately downgraded. Before I leave her, I may want to go to the messaging and actually send her a message to say that you are okay, you don't have to worry, everything's okay. So I'm just going to message her here. So my job here in the call center is to monitor the patients and take care of the alerts as they come in. In prioritized order, we have the red ones, the yellow ones. We also have the blue ones, as you can see on the screen here. Those who are blue are non-compliant in the sense that we have a schedule, and if that schedule is maintained and the data comes in according to schedule, nothing will be flagged. But if they are outside of the schedule, they will give a blue alert. We get data from the patients when they submit data according to schedule, and if they don't submit data according to schedule, we also get notifications that they are out of compliance. So this gives us both sides and proactively opportunities to react to both getting the data and not getting the data, which is what we need. Thanks.